12 shocking things your stool says about your health. Doctors want you to pay attention. Let's be real. Nobody wants to talk about poop, but what comes out of your body can reveal a lot about what's happening inside. While it may not be the most glamorous topic, your stool could be the key to detecting hidden health problems before they become serious. From deadly diseases to minor dietary tweaks, here's what your bathroom habits are desperately trying to tell you. 1. If your poop is hard and lumpy, you might be severely backed up. Struggling to go? If your stool resembles small, hard lumps, it's a sign you're dealing with constipation. This happens when waste moves too slowly through your digestive tract, often due to dehydration, low fiber intake, or lack of exercise. In some cases, chronic constipation could be linked to underlying conditions like thyroid disorders or even neurological issues. 2. Pencil-thin poop could mean something more serious. A stool that's consistently narrow or ribbon-like isn't just a random quirk, it could indicate colon issues. While occasional thin stool isn't alarming, persistent changes might signal a blockage, inflammation, or, in worst cases, colon cancer. If your poop is regularly coming out in slim, snake-like shapes, it's time to check in with a doctor. 3. Black, tarry stool, a silent red flag. Seeing black stool in the toilet might make you panic, and for good reason. A dark, tar-like appearance often means there's internal bleeding somewhere in your digestive tract, possibly from an ulcer, liver disease, or even gastric cancer. If you haven't eaten black licorice or taken iron supplements, don't ignore this. Seek medical attention ASAP. 4. Green poop? Your body is speeding things up. If your stool suddenly turns green, don't freak out just yet. This often happens when food moves too quickly through your intestines, preventing bile from breaking it down completely. It could be due to stress, food poisoning, or a sudden diet change. Hello, kale smoothies. But if it's paired with diarrhea or lasts for days, an infection or digestive disorder could be to blame. 5. Blood in your stool is a major warning sign. Blood in the toilet bowl is never something to ignore. If your poop has bright red streaks, it could be hemorrhoids or a small anal tear. However, darker or maroon-colored blood might point to something more serious, like diverticulosis, inflammatory bowel disease, IBD, or colorectal cancer. No matter what, get this checked immediately. 6. Floating, greasy stool? Your gut isn't absorbing fats properly. Ever notice your poop floating and looking extra oily? That's a telltale sign of malabsorption, meaning your body isn't breaking down fats properly. This could be caused by conditions like celiac disease, pancreatic issues, or gallbladder dysfunction. If it happens often and comes with weight loss, don't ignore it. Your body may be struggling to absorb vital nutrients. 7. Yellow, foul-smelling stool could mean trouble with your liver or pancreas. A yellowish, greasy, and particularly bad-smelling stool is a major red flag. This might indicate issues with bile production, which is essential for digesting fats. It's often linked to liver disease, pancreatic disorders, or even a parasitic infection like Giardia. If this is a regular occurrence, a doctor's visit is a must. 8. White or clay-colored poop means something's blocking your bile flow. Bile gives stool its normal brown color, so when your poop turns white, pale, or clay-colored, it could mean a serious liver or gallbladder problem. This might be due to bile duct obstructions, hepatitis, or cirrhosis. If you also notice yellowing of the skin or eyes, jaundice, don't wait. Seek medical help right away. 9. Mucus in your stool. Your gut may be crying for help. A little mucus in stool is normal, but if you start noticing excess mucus paired with diarrhea, pain, or blood, it could be linked to IBD, infections, or irritable bowel syndrome, IBS. If this keeps happening, especially with stomach cramps, your gut could be inflamed and in distress. 10. Explosive, watery diarrhea could signal infection or food intolerance. If you're running to the bathroom non-stop, you might be dealing with an infection, food poisoning, or a digestive disorder. Chronic diarrhea might also be triggered by lactose intolerance, Crohn's disease, or even stress-induced IBS. If it lasts longer than a couple of days, dehydration becomes a risk, so don't wait too long to see a doctor. 11. A rotten-smelling stool may mean something's off in your gut. Let's be honest, poop doesn't smell great. But if the odor is particularly foul, putrid, or out of the ordinary, it might indicate an infection, food intolerance, or gastrointestinal disorder. Certain infections, like C. difficile, release toxins that make poop smell downright unbearable. A gut imbalance or even cancer can also contribute to a drastically worse odor. 12. No poop for days? Your body is sending a desperate SOS. Going more than 3 days without pooping is your gut's way of begging for help. Chronic constipation might mean you're dehydrated, low on fiber, or even dealing with an underlying condition like hypothyroidism, diabetes, or a neurological disorder. If fiber, water, and exercise don't get things moving, it might be time for a deeper medical evaluation. The bottom line, pun intended. Your poop is like a built-in health report, giving you crucial clues about what's happening inside your body. While some changes are temporary and harmless, persistent abnormalities, especially bloody, black, pale, or consistently loose stools, should never be ignored. Your toilet is trying to tell you something. Are you listening? Medical disclaimer. This article is for informational purposes only and does not constitute medical advice. If you are experiencing any unusual or persistent changes in your stool, consult a healthcare professional for proper evaluation and treatment.